I'm really excited about the future for paediatrics in Southern. We started from a really low point and we're a couple of years into probably a 10-year journey, but I'm really excited about how far we've come and what I can see for the future.
Back in 2016, I remember standing up at a medical staff council meeting as a GP registrar and saying, where do I send this child to for outpatient paediatric care? And the answer was Canberra. It's now grown to about 200 children a month here with our own paediatric local service, so it's really exciting.
Back in 2016, we got some limited funding from the ministry to look at paediatric capability. We had 18 families and it was actually quite an emotive day because we had 18 families in crisis. We had 18 families that couldn't get what they needed out of our health service. The main themes that came out of that was travel, cost of service, local clinicians not actually understanding their needs, no consistency in care. Communication was also a big challenge. So it was many steps forward and then many steps back.
After the Paediatric Capability Project, Dr. Fletcher started with us in Bega in 2019 and he was the first permanent paediatrician that we'd had. This meant the local families really started to get the care they needed and we reduced patient transfers. The paediatric service really gained a great advocate. He showed us how it could be done.
The issues in the region would be headlined with workforce, 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 workforce and workforce. There was no sort of infrastructure planning, there was no planning around maintaining workforce, there was no looking at the outpatient side of things, and they just said, right, we'll hire paediatricians.
We couldn't recruit permanent paediatricians, so it ran a locum-dependent service for about 5 years.
And that is a long time to be a fully locum-dependent workforce. We've been late to establish a workforce and we've had a very fragmented workforce for a long period of time. So that actually increases the medical complexity and the social complexity of the children that we're dealing with. You've got an area that's already got a fairly high portion of people that are low socioeconomic background, but also you've got quite poor health literacy. They don't know what they don't know.
We actually had to put a lot in place to make this an attractive place to work. We know we live in paradise, but we needed junior medical staff so our consultants weren't overwhelmed. We needed to make sure our on-call roster was 1 in 4 because paediatricians don't want to do every second week on-call 7 days a week. It's actually not achievable. Workforce support's really important. We never had junior medical staff, now we do. We're now teaching junior medical staff. Admin support is something that we've had to do. So you've got to resource a service to make it sustainable.
How do you attract a workforce to a rural area? How do you keep a workforce in a rural area? How do you keep them good in a rural area? Mentally good, physically good, continuing to maintain their skills in the context of isolation. We're now at 4.6 FTE paediatricians. So we've got 0.4 fractions still vacant, which we're working on how is best to recruit and fill that. And we have plans and I think we will manage to do that. So that's an unbelievable change in 2 years.
Since we've had paediatricians locally, it's of great benefit for parents because they don't have to travel, there's no extra cost in accessing a service, and parents are less stressed and there is an opportunity for great follow-up.
We've worked out we want to have a sustainable team of paediatricians who don't burn out, who have a really good balance between workload and lifestyle, because one of the fantastic things about Southern is it's such a beautiful place to live, and finding that balance between the work being challenging and satisfying without being overwhelming, which means we need a team of us doing it so we're sharing the workload. Sometimes you don't have the population or activity to justify a service, but geography means if we don't provide that service, the families or patients will have to travel a very, very long way to access that service. And so it's trying to find that right balance.
I guess the benefit of working in Bega is that balance of really great paediatrics that's got a rural focus, but also not being a sole clinician and getting to work with other paediatricians.
With paediatrics, the reality is kids can have complex, difficult conditions that do require that tertiary hospital subspecialty expertise. And so we're all about care, coordination and partnership.
The paediatric care coordination role cares for kids with varying levels of medical complexity and different levels of medical need and intervention. We typically don't have access to paediatric subspecialty services in a rural setting. At the moment, there are somewhere between 60 and 70 kids receiving care through the Paediatric Care Coordination Service. However, this service is now essentially at capacity with that number of medically complex kids. So I am very mindful that there are an increasing number of kids within the community with medically complex needs who are not receiving the care that they require.
The care coordinator for this region, Pip Street, has been absolutely vital. We call her the heartbeat to our treatment. We are quite an intensive case. Hugo takes up a lot of her time. Without Pip, I genuinely say that we would not be able to live at home with our family, be with my other children. They are the only people we see because we are in isolation, and we adore them for it.
One of the things that I think I'm most proud of is that when we started to run recruitment for the Coastal Network for Paediatricians, is we got a lot of applicants, and everyone that applied, when we said, why have you applied for this position? They said it's because of the team.
The first time we had a proper team, like not just me and one paediatrician, but me and more than one paediatrician of local paediatricians, I actually cried. And everyone hassled me, but that's okay. It's such a big step for the region, and you know, it's so amazing for the families and children.
I firmly believe that Southern can become an absolute leader in rural paediatric care. And I think we've started by establishing the right team to do that.
People go, oh, you're from Southern, must be so hard down there. But finally, I actually don't feel like the poor cousin anymore. We've done a lot of work, it hasn't been easy, but I actually feel like we're getting there.
In the next few years, I think a lot of stuff will continue to improve and evolve. In our Coastal Network clinics that we're doing in Eden, Cooma and Eurobodalla, I really hope to increase the numbers in all of those areas, as well as have more interactions with the local treating teams, including GPs.
What I would love to see is that we've got 3 well-established paediatric hubs, one in Goulburn, one in Eurobodalla and one in South East Regional, that each of those hubs providing outreach clinics and services to the areas around the hub. And the other piece of the puzzle is what I call care coordination. We really want to partner with those tertiary centres, coordinate the care and keep the trips to Sydney as short as possible and as well organised as possible so that we can get lots of things done in one visit.
We've made a huge amount of gain in what is a very short period of time, but we still have a long way to go.
What's really made it sustainable is that we're a team of local paediatricians, and together with our amazing paediatric nursing staff and our very skilled allied health, our very supportive medical administration team, we're able to expand as a service and to teach medical students, to attract junior doctors, and to really build a coastal network.